A team of health workers fighting against AIDS in the remote, underserved communities of northern Kenya. Over the last few decades, HIV/AIDS has become one of the leading causes of death in young people in Africa, including these largely nomadic people. Lucy, who has HIV, works alongside the clinic team. In her time remaining, she wants to reach out to as many people as possible to save them from infection with the deadly illness. This Turkana man does not believe that although Lucy is HIV positive, she's been fit and healthy for several years. There is still a massive lack of information. 1 in every 20 people tested by the clinic is HIV positive. In an improvised field clinic, Nurse Pauline gives vaccinations to children. The mobile clinics immunise 4,000 children each year. During her treatment, she informs mothers about the possibilities of family planning and protection against HIV. On average, women have 8 babies each. Huge parts of the Maasai land are still far away from civilization and therefore mainly without infrastructure and medical treatment. Lucy and the team squeeze into the mobile clinic vehicle. The team treats more than 60,000 people each year in Laikipia and Samburu. The mobile clinic is the main source of healthcare for several different tribes, with an average of 90,000 visitations to the 2 mobile clinic services a year. A variety of sponsors from Europe and the US facilitate the work of the mobile clinic teams, which needs $250,000 per mobile clinic team a year to be really effective. Driving through these areas with the plentiful game reminds one of being on a safari. Often the team is on the road for several days and must sleep in tents in order to cover the huge distances. In the fight against HIV/AIDS, the mobile clinic has put emphasis on trained community-based HIV counsellors. The mobile clinics have trained and work with 17 strategically placed in the remotest underserved communities throughout the 2 regions. The HIV counsellors visit people in the privacy of their homes to talk about HIV and to test them for HIV. Antiretroviral treatment can improve and prolong the life of someone with HIV, but it is best to start this treatment before the person becomes very sick with AIDS. The only way to do this is to identify infected people when they are healthy, which means testing as many normal and healthy people as possible at every opportunity. Lucy's workday has ended. AIDS has weakened her and she can only work every other day for the mobile clinic. What the disease means for Lucy and others infected with HIV is poverty and social rejection.
When Faith Wangu was 9 months, he was sick and admitted. I was advised to get a test of HIV test, me and Faith, and the result was positive.
That was 6 years ago. In the meantime, both their other children, Lillian and Anthony, have also been tested positive. Her husband David is also infected. Only the youngest of the family, Martin, was able to escape HIV through antiretroviral treatment while Lucy was pregnant. Once a month, Lucy, a tailor by trade, is able to afford a bush taxi to visit her daughters in a home for HIV-infected children. Her daughters, Faith and Lillian, have the advanced stage of AIDS, like all other children in their home. They need constant medical treatment to keep them alive. Antiretrovirals are free, but it is the cost of accessing these that is still unaffordable to most people in these regions. Due to the distances involved to get to the district hospitals and health centres, and the nutrition, which is an essential accompaniment.